Now I'm going to turn to the panel and I'm going to ask some questions of the panel, and then please do put some questions in the chat. And I'm going to allow the panel just to reflect on what they've heard, but also just to talk about how it feels in their parts of the country. So Jane, I'm going to come to you first, Jane, and please do unmute yourself. And Jane, I guess the question, we look at GM and we look at the history of GM in this, and they're still at the forefront of devolution. How does it feel on the ground around health and devolution, Jane, in GM?
Thanks, Michael. I'll start by just giving a bit of context before I could move on to kind of how it feels, just to kind of bring it alive a bit. So I think GM's often described as the poster child for devolution in England, and we certainly have had a long history of working in partnership to improve the lives of our residents, and that's the stronger together ethos that you kind of mentioned in your presentation. And health and care systems has been really central to this in GM. We were the first city region to secure that devolution deal for health and care. And that really enabled us to develop a shared vision for place-based integrated services organised at a neighbourhood level. And as such, really, Greater Manchester Health and Social Care Partnership became the original prototype for ICSs. Obviously, we've got a lot of things in our favour. So we have got that coterminosity with a mayoral combined authority, which others don't have. Our size, that gives us the capability to act at scale, to deliver effective services, particularly for the health service, but also in jobs, skills, planning, housing, transport and air pollution, to do something around all those things. And that scale and the assets that we've got also mean we're a good place for research and innovation. That kind of point about building the evidence base, I think, is really important, Michael. And then also we've had a very long-standing recognition in Greater Manchester about our population health goals being intertwined and codependent, and the importance of health and care in kickstarting economic growth. And again, the fourth point I'd make is around the Office of the Mayor to help drive, convene partners, cajole, advocate at national level, and also really has that strong mandate from the local population. And I've seen that mayoral soft powers being increasingly important in our footprint. The kind of how it feels bit, just reflecting on that element, Michael, was it's not always been a smooth journey. It's been long and complex. And currently, with the crisis in our public services, those financial headwinds are so strong, it's creating a very difficult operating environment. And perversely, I think since the introduction of ICSs in GM, our kind of place-based model and mission has stagnated a bit as we've wrestled with an alignment to a stronger national framework, a focus on structure and governance. So we've been inwards focused, increased national grip and control, as centralisation being seen as a way of managing those pressures. I also would reflect that the current NHS regulatory environment doesn't allow us to focus on the core purposes of the NHS. And also, and this is a kind of, this is a point that kind of Darcy picked up as well, it's the lack of incentives and financial levers to support the core purpose. So what we want is a leftward shift in the way we invest and in the way we deliver services. And all the time we've got a rightward drift, which kind of started during the pandemic. So in terms of ICSs, there's potential there, but our attention is being skewed to money and waiting times. And it feels to me sometimes the progress on population health is seen as desirable, a luxury, and not essential to a well-functioning integrated care system. So there's a bit of a difference between rhetoric and reality. But things are changing, leaving this bit on a positive note. I think there's a lot of renewed energy, optimism and innovation happening now within our system as we've got alignment between national government ambitions and our own mayoral commitments and system vision. Things like NHS GM and the CA are now co-located in the same building, so further enhancing integration, deepening existing partnerships, and we're looking at some key joint appointments. And also, as you pointed out, our mayor has taken on, so Andy has taken on chair of the the Integrated Care Partnership Board very recently. And I think that sends a really strong signal about the interdependency between devolution and the ICS core purpose. And I think that will be pivotal to how we move forward. And I think those joined up conversations with government, because I think as well what Andy will do chairing that board is allow us to have more joined up conversations with government. And I've seen that happening already in the last 2 months.
Jane, that's absolutely fantastic and really interesting reflections. And I suppose there's something that you mentioned, we'll come on to this. I'm sure this will be a theme throughout the discussion, Jane, is about some of those typical NHS metrics and and how we work in the health service. And you've just spoken there about, how actually at least now you're having the horizontal conversations to actually push back against some of that, upwards national in quite siloed NHS accountability there. But of course, this is a city region that's quite well used to this kind of conversations. It must be very challenging actually in areas where actually you're having to almost push back against some of the national NHS diktats in a way where you're not quite as mature. So we might compare and contrast that. But Jane, I thought that was absolutely fantastic intro to how life feels on the ground in Greater Manchester. Dave, I just want to turn to you now and just get some of those findings from and the lessons learned from your recent report, which actually focused on GM, I think, didn't it, Dave? What came through in that might give us a bit of positivity and a pause for reflection as the devolution white paper comes out?
I think, in a way, Jane's stolen some of my thunder, because obviously Jane and I work very closely together on that piece of work and previous pieces of work. So I probably want to emphasize some of the things that Jane said, and then maybe pull that forward to what that might mean for others. But I think starting points are really critical here. So GM is different. So I think drag and drop is not possible, but specifics, but drag and dropping some of the principles that lie behind GM's success, and I would call it success, actually. So for those that don't know, the Health Foundation commissioned some work some time back looking at life expectancy and other sorts of outcomes, and commissioned subsequent work on a wider range of health and related outcomes. And Greater Manchester is doing better on those sorts of many of those indicators than you might expect, given all the characteristics of its population. So something is going on in Greater Manchester, and the Health Foundation's work helps sort of like point towards some of that. And the piece of work that Jane and I worked together on was really getting under the skin of it. So more qualitative work, talking to folk and people, particularly between the GM level and the more local level, and the relationships between those levels. So the piece of work really is sort of a deep dive qualitative piece, and can stick it in the chat, or the link to it's on our website, or we can send it afterwards. And just to say also that we've been working with Jane for a long time, so pre-COVID, and that piece of work was interesting in itself. That was a more private piece, but we actually looked at GM and compared GM and what its approach was to population health, both compared to London as a sort of like a big, the global city, and also other international cities and regions that were doing good things on health. And what Jane has said and what comes through that report, and sort of like is reiterated in this new one, more public one, was about the roles that cities take up, and the enablers that enable them to fulfill those roles, of which mayoral soft power, and particularly learning from international experience, both in Europe, around the world, and in the US, the metro mayor sort of not experiment, but changes in the 60s and 70s in particular, really came through very strongly. So the role of soft power in Greater Manchester is really, really important. Greater Manchester, like any other place, London is probably even a step beyond any other place, is very complex in terms of governance. So soft power is from a mayor and others around them, as well as local elected politicians below mayors, really, really important in a way to cut through some of the governance and to connect to real people and communities. So mayors can do lots of things. They can advocate, they can cut through governance. I think Andy Burnham is obviously clearly a very strong advocate for Greater Manchester in national conversations. They can also experiment more, actually, which I think is going to be really one of the really interesting potential futures for devolved authorities. What can they experiment with, which then others can learn from, and also national politicians can learn from. So they can experiment more, they can take more risks than maybe national politicians can do. So there's the feedback loop between Greater Manchester and the national picture and other emerging areas. But in terms, coming back to your question about some of the sort of key parts of what we see as the success of Greater Manchester, but also, as Jane says, the challenges. It's difficult. This is not easy. And I think in order to move forward and keep moving and be resilient, you need a very strong vision, very clear and strong vision about what you're trying to achieve. And that needs to be shared and needs to be accepted by key leaders at all different levels within a place or a region or a combined authority, whoever they are. And Greater Manchester has been very fortunate in having that, and it's had it for a very long time. And so actually it is, it is one system, one place, and people do really, compared to lots of other places, in my view, there's a sense of identity and a sense of purpose. And that's easy to say and very hard to do, but that really holds people in good stead. And that is related to then consistent strategic leadership over time. We're struck, particularly first time round, we'll come on to some of the challenges, I think, just how many people have been in Greater Manchester for quite a long time, but they've been in different roles and different places within Greater Manchester. So there was a consistency and a lots and lots of experience, but in slightly different roles, different places. So a really sort of like a coherent view of what Greater Manchester is and what the people in Greater Manchester are and what they need and what they have and what they don't have. As I said, there's a vision, there's really consistent strategic leadership, and then there's a sort of like a model or approach, a population health model, which, as you were saying, connects, which is similar to the King's Fund's population health framework, but is GM specific, which connects all of the sort of like the policies and goals that relate to health and particularly the economy and society in Greater Manchester. So there's something visual, there's something that you can refer to and to check against and say, actually, is what we're doing actually consistent and aligned with this? Is it third or fourth? I don't know. But that point that you made about the economy and health being two sides of the same coin, I think it also comes across very, very strongly at GM level, but also at local authority level in particular. So health plans, population health plans are embedded in economic plans, and economic plans are embedded in population health plans. And I was struck again, when you're talking, Michael, about economic and health plans, about two sides of the same coin. I was also struck that about 5 or 7 years ago, I went to talk to the Centre for Progressive Policy, which is an inclusive growth think tank, and I went to talk to them about population health, and they were talking about inclusive growth, and we were looking at the same stuff through slightly different telescopes. And your point about parallel lines too. So I think there's a much bigger realization probably earlier in Greater Manchester, partly because of history, partly because Greater Manchester's been going at it for a long time. So one of the challenges is, how much time do you need and preparation time do you need to do what Greater Manchester has done well? Obviously, contexts are different, and so what's the run-in time for devolution and the white paper? How fast can we actually move? And what are the risks of moving too fast? Perhaps that might be something to pick up, and I don't necessarily know the answer to that. But just to come on, we'll finish in a minute. As Jane says, it's it has been really, really difficult. So that requires consistency of leadership and Jane's and values. And Jane is a perfect example of that, and colleagues around her. But there's also been a lot of, Jane I'm sure would say, it's been a lot of senior leadership change in Greater Manchester. So so we're at a bit of an inflection point. So a lot of senior leaders have moved on. A lot of the public health community directors of public health, I think 10 local directors of public health, they're all different since COVID. So that continuity is really important. And in a way, our report, I think, helps the continuity within Greater Manchester, as well as telling others what Greater Manchester has done. It also hopefully helps Greater Manchester also sort of reinforce that it's on its own journey, particularly for new leaders. So you have to keep investing in that knowledge, in that institutional vision, in that institutional framework. The moment you rest, it's at risk of going. So that takes a lot of effort, but I think it's effort that's worthwhile. And then, as Jane says, the financial challenges are there for Greater Manchester, they are for anybody else. What Greater Manchester also benefits from is a really strong analytical engine and community. So very strong analysis. So they have very good modelling. good modelling only gets you so far, we know, because these are political choices, really, small p, big P, but very good modelling that sort of says, well, if we invest in these various forms of population health, then we're likely to be able to face these financial challenges as opposed to be swamped by them. And I don't think that's the same in other places. So we've worked at the King's Fund with lots of places who and integrated care systems who want to do population health. And some of those that we work with, our work stops because we've got to tackle the immediate financial problems. Greater Manchester manages to do those twin tracks. So we have got immense problems, but we have to keep going on this because this is the only way out of them in the long run. And we have to focus on the future as well as the here and now. And then the final point, I think, is this willingness to learn and to be challenged. So the fact that they commissioned us to, and it is an independent piece, editorial, completely independent. The fact that they commission work and are willing to hear and listen to things that that maybe you don't want to hear is also very important. So willing to adapt and to change, but with that rooted consistency of vision and purpose that underpins it all. So that would be my not so potted, but the report has got lots and lots more nuance in it, as you can imagine.
Dave, the links in the chat for the report, and I'd just say that was a fantastic explanation of place leadership. I think what you've just told, all those ingredients that you've just run through there, Dave, I think that they make you pause and reflect on where you are in a country, don't you, and whether you see what you've described in front of you, and when you hear about them in your conversations. I think, Dave, that was fantastic. And a bit about experimentation, and Jenni, I'll come to you in over in the East Mids, and 6 months, is it 7 months, Jenni, into a new devolved arrangement. I suppose that sense of experimentation Dave mentioned, just how is it feeling, Jenni? What's different, what's exciting, what's fun?
So, yeah, thank you very much. I think, the East Midlands is very different to Greater Manchester. So just to give a bit of context, we have 4 upper tier authorities, 2 are unitaries, 2 are county councils, who are sort of the constituent parts of the authority, and then 15 districts who sit below there as partners, but are not sort of the core team, which leads to some interesting sort of dynamics. On top of that, we have 2 ICSs and lots and lots of other numerous NHS type institutions that fit within the sort of the NHS family of activity. So for us, a lot of this at the moment is being flat out, sort of pedal to the metal of trying to get the funding that we've got sort of allocated and spent, because that's what people expect to happen. And sometimes it doesn't always feel that we've had enough time for reflection about how we're actually going to get these things embedded, how we're actually going to change what's happening. So, our mayor, in terms of Mayor Clare, so Mayor Clare Ward was elected in May, has a real keenness of improving the disparities across the region in terms of health. So we have some district areas where there's a 10-year life expectancy difference between the top of the district and the bottom. We have these pockets of urbanness in the 2 cities, but then we have some really rural areas. So we've got some real challenges in terms of what we have as a landscape of sort of our populations. And a lot of our more rural populations are actually quite almost locked in terms of accessibility to other populations around them. So whether that's a transport issue or even a location issue, that actually getting out and about and sort of seeing other communities can be quite difficult. I think, in terms of health, we have a real ambition of doing more than we are doing at the moment in a strategic way and taking it forwards using those sort of inclusive growth type of approaches. We've just launched the Inclusive Growth Commission, and health is part of that, sort of in terms of one of the many pillars that inclusive growth has. And linked to that is very much the prevention agenda. So I would say that we really need to be, and I suppose what is coming through loud and clear from everybody is focus on the prevention. There's a lot of good work happening at the front end in terms of delivery for people. We know there's problems in it. We're not saying, not shying away from those problems. But if we really want to make a difference strategically and long term, then we need to start prevention now so that it's a generational set of sort of differences. I think the East Midlands, different to GM, is that GM maybe had the luxury of working in a more sort of cohesive way before they got a Devo deal. And so they've had a much longer run-in time. The East Midlands, 4 constituent councils came together. They weren't always comfortable bedfellows before. They're being asked to be sort of work together in a strategic way. When money gets involved, that creates its own issues. And I think there's a lot of work trying to build the partnership and build the trust amongst all the political leaders in terms of what we need to do to make it better for the whole region. But it is still sometimes that parochialness takes precedent, and that's going to take, again, years to sort of get over. And it's the trust that develops working together on a long-term basis that is better. So, you know, for us, we've already had a change of one of our leaders. So Councillor Ben Bradley, leader of Nottinghamshire County Council, sort of pushed the deal through. You know, Ben has now stepped down from being leader of the County Council and is now sort of, you know, changing roles. Very good for the region because he's got incredible amounts of knowledge, but it already means the top table has changed dynamics in terms of what people are able to do and what people are able to support, which again has a knock-on effect about embedding that trust. So, you know, there's lots going on. It is just very, you know, we are really sort of early days. And I think colleagues would say is that they're running, you know, we don't even have strategy and action plans and targets in place, but yet we're almost running and trying to spend the money because we've got such deadlines and targets on the deal money coming through. But it's about that reflection, is, are we spending it in the right place and is it going to make the right difference?
Jenni, thanks for that. And I think that point you made about we had less of a running time. There'll be lots of people from across England who are about to witness new ideas coming through, new geographic footprints coming through, new Devo deals coming through, and they will absolutely be in your position. I think, won't they, Jenni? And it comes back to that state of readiness of some parts of England actually to take on power, because this is a serious business, isn't it? And to take on powers and to narrate your own journey. Jenni, that's fantastic. And please do ask questions for Dave, for Jane, and for Jenni on their experiences. We've got a question about business. We'll